Okay, so we can find some light here. There we go. It's getting darker and darker. Last time we were talking about HIV, and actually it's a very good time to talk about HIV because World AIDS Day is coming up. All right, so we're in the time zone here. Okay, so last time we talked about what HIV looks like. We're going to go into that in more detail and some of the symptoms. What I want to show you in this slide is what happens during the course of an HIV disease. Okay, so this is what happens in a patient, and we have a graph here where we're looking at how much time passes since the onset of disease, or since the onset of exposure to HIV, okay? And we're measuring different parameters of this disease. One is we're measuring the amount of HIV in the blood, okay? So that's the red line. The green line is we're measuring the CD4 T cell count. So why are we measuring the CD4 T cell count? Why is that significant? Yeah, what does HIV attack? T cells, right? These are the cells that HIV attacks, right? So that gives us a way of seeing the extent of infecting them with the disease. And also this purple line is the antibody against HIV. Okay? All right. So the vertical axis represents the way that we can measure these different parameters of the disease, and then this is the graph over time. Okay? So 0, that's where you get initially infected. Okay? Now, what happens? So as you can tell, the HIV goes up, right? What happens to the T cell count? It goes down, all right? But if you notice, after that initial decline in T cells, and after that initial increase in HIV, right, which you expect during an infection, what happens to the HIV levels? It goes down again, right? Why does it go down? What's happening? What's being produced to make it go down? Antibodies, right. So the immune response does kick in, and you can see that from the antibodies. So you can see how the antibodies against HIV go up, okay? And that exerts some control over the amount of HIV, okay? What happens to the immune response though over time? It wears out. So the antibodies go down. Why do the antibodies go down? What's causing the antibodies to go down?
The HIV keeps mutating.
Huh?
Does the HIV?
Okay, the HIV keeps mutating, but what in the immune system is failing? Yeah. So if you look at this, what else? What part of the immune system is going down? T cells are going down, right? So how is that related to antibodies? So what produces antibodies? What type of cells produce antibodies? B cells, good B cells, okay. So how's that related to T cells? Yeah, T cells, yeah, so these are what kind of T cells? T helper cells help what kind of cells? T cells, right? So if your helper T cells go down, the B cells don't have that help to be able to make antibodies. And so the antibody levels are going to go down. Okay? So that's why that shows the importance of those helper T cells. Okay, why they're important for this response. Okay? So those go down, right? Because remember the T cells are going down because HIV is attacking it and destroying them. As they go down, as those T cells go down, so does your immune response, your antibody response. Okay? And then what happens to HIV as a result?
Goes up.
Spikes up, right? Right? And eventually this can lead to death. Okay? Mainly because your immune system is gone. And so what happens in patients is that they get these other infections that ultimately kill them. Okay? All right? And so you can see the steps here. The initial infection, get an immune response. That's number 2. Number 3 is where the T cells start to climb. Number 4, HIV production starts to increase. And then finally the patient dies, okay? All right? And again, what we're trying, one strategy is to try to at least, we can't get rid of the HIV, at least get it to a point where we can sort of keep it at this level here, all right? So try to manage the disease as a chronic disease without actually having the patient succumb to HIV-related deaths. Okay. Any questions about this? All right, so let me give you a definition of AIDS. This is a clinical definition. It's one that you can test in the laboratory, and this relates to the CD4 T cell count. Okay, so again, CD4 T cells. What kind of cells are we looking at? Helper, right? So remember from the last unit, CD4 is found on helper T cells. So we're using that as a marker. And what we count is the number of T cells, helper T cells, per cubic millimeter of blood. Okay. So in normal patients, that would be between 800 to 1200 T cells per cubic millimeter of blood. Okay? And that's actually a pretty small amount. Right? You have to measure millimeter by millimeter by millimeter. It's a really tiny cube. All right? There's going to be 1200 up to 1200 CD4 T cells. Okay? Now, this gives you the symptoms that show up when depending on the patient's T cell count. If they're above 500, right? If they're above 500, they're going to be asymptomatic. Right. So even if they have an HIV infection or they test positive for HIV, as long as their T cell count is above 500, they're going to be asymptomatic. Okay. They start showing some symptoms if the levels of T cells drop to be between 200 and 499. Okay. They'll start to show some symptoms. So how these symptoms might show up is like when an HIV patient catches a cold, right? So let's say you catch a cold. Let's say you catch a cold, right? If you catch a cold, how long does it take for you to recover?
3 to 5 days.
Huh?
3 to 5 days.
Yeah, 3 to 5 days, maybe 3 to 5 days for a common cold, okay? All right? For an HIV patient, it may take like 3 weeks or a month, right? And they would be like in bed for a lot of that, okay? So it just wears them down. It takes them longer to recover, it's harder for them to sort of manage having an illness even like a common cold, okay? We once had an HIV patient talk to the accountant about what she was going through, and her counts were about in the 300s, okay? All right. Now, if the levels drop below 200, so again, we're looking at 200 T cells per cubic millimeter of blood, that's when you have full-blown AIDS. Okay? So that's where we clinically define AIDS. Right. Any questions about that? So again, this shows you that what happens during an HIV infection is this. This is an important parameter. Right? The T cell counts go down, and you can see that as we progress through the different stages of an HIV infection.
So the clinical latency on that previous graph, that's just where you have an adequate amount of
Yeah. Right.
CDC.
Yeah. Exactly. Okay. In fact, you can see the count right here. Right. So that's the CD4 T cell count. Okay. And so when it gets down below this 200 mark, that's when the latency period ends, and that's when you have full-blown HIV, full-blown AIDS. All right, any questions about this? Okay, this goes into the structure of the retrovirus. Remember, HIV is a retrovirus, and So if it's a retrovirus, does it have RNA or DNA as its genome? RNA, right? So you can see that here. Okay, so they show the RNA. And there are some other things mentioned here. First of all, it has an envelope. It's an envelope virus. Okay, this goes back to what we learned earlier in the course about how some viruses can have envelopes. And it has some enzymes that we're going to talk about. Integrase is one, protease is another, reverse transcriptase is another. Okay, and there are some proteins that that are important for HIV, like Ch.18 is one of them. Okay, so that will probably come up. All right, this is what the virus looks like. Now this is kind of a summary, a summary of what happens during a retrovirus life cycle, the HIV life cycle. All right, so this is kind of presented in simplified form. Where here we have the virus. It infects the host cell. This will be a T cell. And then what happens is that the viral genome, which is going to be RNA, okay, that enters the cell, and there's a process that we're going to go into called reverse transcription. Okay, reverse transcription. All right, so now if you're going from if you're doing regular transcription, like normal transcription, you start with what? Is it DNA or RNA? DNA. Right? You start with DNA and you end up with RNA. This is reverse transcription. So in this case, you start with RNA and you end up with DNA. Right? That's why we call it reverse transcription. Okay. And you can see that sort of here, where here's the RNA. This undergoes reverse transcription to become DNA. Okay. That DNA actually inserts into the host genome, into the host chromosome. Right? So if you have an HIV infection, you test positive for HIV, the viral genome as DNA is stuck somewhere inside your human genome. It's stuck in one of your human chromosomes. Okay? And that's what happens in an HIV patient. From there, it can start to produce the components that are needed to make more viruses. Okay, so it acts like a home base, new home base for them, from which they can produce more components, more nucleic acid, more proteins, to make more virus, and then at the final step, the virus buds out. Okay? Any questions about this? So we're going to go over some of these steps a little more carefully, because they have some clinical significance. Here's one. So this goes back to when we talked about some of the steps in virus replication. Right? The first step was attachment. So this is where the virus has to attach to the host cell. And this is where Ch.18 comes in. So Ch.18 is a protein that's present on the virus envelope. Okay, so we look at the virus, here's Ch.18.